Tips from Dr. T, your best dental resource. Let's go. We're gonna talk about braces and Invisalign today. Clear or metal? Which one do you like? What's your preference? Make sure to always consult your dentist or your orthodontist which one is the best option. But let's go over pros and cons and different types of which one, what's best. There are a bunch of different new brands out there that kind of do Invisalign, but Invisalign is Invisalign because it's one of the ones that's been out there the most and has the best resources and research out there behind the teeth movement and shifting and so on and so forth. So which one would I suggest go with? I think Invisalign is your best option compared to the other ones that are not as resourceful. Number 2, braces. When can I do braces? When can I do Invisalign? If teeth are super crowded and require really big, huge, crazy movements, you would be better off to go with brackets because they help move teeth in a better way or more efficiently if there's a huge issue as far as crowding, underbite, overbite, all those kind of stuff. But I have seen some crazy cases of Invisalign that's been done. It takes longer sometimes just because plastics don't move teeth as fast as brackets can, but I've seen some crazy cases with Invisalign that it's kind of borderline should you have had braces or not. In general, make sure to consult your healthcare professional, your dentist or your orthodontist, but those two options are both great options. Who's the most qualified? I have seen dentists do them and I've seen orthodontists do them. There are some orthodontists out there that push towards just know you have to see your orthodontist, but there are cases that really you don't have to see orthodontists. It can be done with your general dentist. It's always good to have a dentist that knows their limitations and stay away from some crazy cases and let orthodontists handle those. There are a lot of easy, straightforward cases that can be done through your general dentist and really does not require specialists to do it. How can you know if your general dentist can do it or not? Ask your dentist. Say, hey, how many of these cases have you done? How difficult is my case compared to some other cases out there? And would you recommend me seeing orthodontist or should I have you do it? What would be some of the challenges or problems we're gonna have throughout this process? If they have experience and they've already done it and they've had hands on it, and that makes it so much easier, and you can trust them and you can have them do it because they've already been through it. If you're gonna be the first one, it's kind of usually harder because now they're testing it or trying it and it's gonna make it a little bit harder. However, orthodontists, they can do pretty much all those different hard or easier cases because they're specialized and that's what they do. Time frame is one of the most common questions I get. How long is braces faster? I just wanna get done fast. Invisalign can do it in 3 months, braces can do it in 6 months. No, there's no preference on time-wise. Both can take almost about the same. Why is that? Because moving teeth take time. And I know sometimes patients want to do it a lot faster. There are some designs or some treatments out there, like 6-month smile or some other options that encourage moving teeth faster. But again, all of those are case selective. You have to do your research. You have to make sure the person who's doing it has done it many times and they feel comfortable that this can be done within that short time limit that you want it done. Another pro and con between the two is with braces, your diet is kind of limited what you can or cannot eat. With Invisalign, you can eat pretty much everything. However, snacks are cut down tremendously because you have your trays and you're like, I have to take my trays out, eat some snack, brush my teeth and pop them back in. It cuts down on snacks. So they both have pros and cons. One, diet restriction. The other one, what can you have in between there? As always, make sure to consult with your dentist and pick their brain as far as what's the best option for you so you know all the pros and cons that can affect the outcome and you make the best decision that's best for you.